Chapter 17, Managing Quality and Safety, Sandra Monk. The healthcare system is one of the largest employing systems and industries in the whole United States, and society is always demanding increased efficiency and effectiveness from the system. And the managed care industry, for one, is began with that changing the face of American healthcare through looking at quality, looking at controlling resources that began in the late 1970s. And they began looking at how quality would be defined and how it would be measured. But also, as consumers, we're demanding, we have not as good, healthcare. For the money that we're spending. And so, we've talked about that in several of the different classes. So, related to the quality of care in the United States, very little is really known about the care in the United States because a variety of definitions of quality are used. And also, it's very difficult to get comparable data from all providers and healthcare agencies because every hospital and every healthcare agency, or not everyone, but many of them, use different documentation sources, electronic records, paper records, and so it's very difficult to get the data and to be able to compare that. And so, consumers are really rallying and looking for quality healthcare. We want higher quality and lower cost, and also total quality management. So, in a changing healthcare market, the demand for quality has become a real point. And in addition to the demand for higher quality and lower cost, the public wants healthcare to be delivered with greater access, and also we want healthcare that is accountable, efficient, and effective. So we really want it all. And total quality management is a management philosophy that includes the focus of the client in continuous quality improvement, CQI, or teamwork. And we're going to talk more about CQI in some of the further slides. Quality improvement goals and outcomes. We want to improve the safety of care because that saves lives. It prevents suffering. It prevents injury. And we want cost reduction by using effective interventions and based on evidence-based practice, and to increase client confidence in healthcare delivery regardless of the setting. And other performance information to the public. One thing that is stated could be done is a report card, and it tracks the causes of mortality and morbidity. And the community health card refers to refers to the reports of community health profiles and helps identify where change is needed. For example, it looks at community health profiles, needs assessments, scorecards, quality of life indicators, health status reports, and also progress reports. And quality of the current healthcare system. In the past, it was always accepted that there would be some problems or some type of complications from hospitalizations and for illness, but we are now, we don't want to accept that, as much. And so we don't want to, think that we don't want to plan for the complications. I mean, we want to plan for the complications through prevention, not just accept that they might occur with the productions of things or with the delivery of services, that including that of healthcare. And incentives for healthcare change with the prospective payment system, where we are now expecting quality becomes really important to reduce the number of complications that resulted in longer hospital stays, and there's actually incentives in healthcare for providing excellent care and quality care instead of the previously used fee for service basis. And then quality became important to reduce the number of complications that resulted in longer hospital stays and under the DRG system. Definitions and goals. Quality is defined by the client as the improvement of health status, and it's defined by organizations and providers as accurate interventions and clinical context of care and the skill of the provider. And then quality health care is the degree to which health services for individuals and populations increase the likelihood of a desired health outcomes, and they're consistent with current professional knowledge. Quality assurance and total quality management. Quality assurance is monitoring of activities and client care to determine the degree of excellence attained in the implementations of activities. And quality assurance has been the concern of the profession since the 1860s, when Florence Nightingale called for a uniform format to gather and disseminate hospital statistics. So it goes back way over 100 years. And the goals of quality assurance are to continuously improve the timeliness, effectiveness, safety, and responsiveness of programs, and to optimize internal resources to improve the health of the community. And quality assurance has been improved on or looked at further, and is some other means of managing quality and examining quality. Total quality management is an approach to managing quality of care through an appraisal of the nursing process after the client's discharge from the healthcare system. And then continuous quality improvement is an approach to manage quality that emphasizes continual improvement in real time, empowering employees to manage quality themselves and making changes in organizational systems to enable workers to provide high quality of care. And I just want to say that, quality assurance, CQI processes are not the same thing as evidence-based practice. It's like these are two separate things that are going on. They are interrelated, but going on at the same time. And then there's a comparison of quality assurance versus continuous quality improvement. So quality assurance is looking at external determinants. It detects errors. And then fixes blame and responsibility, post-event investigation, and then the QA is responsible for all this, not all the other employees. And it inspires fear because it's somebody else who is looking at, to detect an error, to detect problem, and then to apply blame. CQI looks at internal determinants and determines requirements and deficiencies and expectations. It identifies process improvements and opportunities. It is based very much on prevention, and all members of the organization are responsible, and it inspires hope. So, and then accreditation also is an approach to quality control used for institutions where licensure is used primarily for individuals. So accreditation is for institutions, licensure is for individuals, but those are all means also of controlling quality as well. The general approaches to quality improvement seek to protect the public by ensuring a level of competency among healthcare professionals. And for example, it is credentialing, licensure, accreditation, certification, charter recognition, and academic degrees. So all of that are the general approaches to quality, and some specific approaches are total quality management, CQI improvement, traditional quality assurances, staff review committees, utilization review, and risk management. And then professional review organizations and evaluative studies that take place, like self-studies and studies that are performed for accreditation. Model quality assurance program would provide the primary purpose of a quality assurance program is to ensure that the results of an organized activity are consistent with the expectation, and they are based on the philosophy and objectives of an organization and of or an agency, and they look at processes which are a specific appraisal of the processes. They look at outcomes and evaluation of outcome standards, and then there's evaluation. Along with the evaluation, there's an interpretation of the evaluation, and then there's follow-up or action that occurs related to a model quality assurance program. Documentation is essential to the evaluation of quality care in any organization. Records are just absolutely integral. They must be accurate, and complete records are required by law of all agencies, whether governmental or non-governmental. Records are essential. And then as a agency, community health organizations and agencies must keep records as well. And quality assurance and improvement mechanisms in healthcare are the mechanisms for controlling the systems and also for requesting accountability from individual providers within the systems. And the records help keep a total picture of the contribution of the agency to the client community as well. And Healthy People 2020 is an example of a national program of quality health care that looks at all of these different essentials of quality. And that's the end of this presentation related to managing quality and safety.